A special thank you to each of our subscribers who make this channel possible. Here's today's story. In a significant and contentious move, the Trump administration has announced new regulations that aim to effectively ban gender-affirming care for transgender minors across the United States. During a press conference held at the Department of Health and Human Services in Washington, D.C., Health Secretary Robert F. Kennedy Jr. and Medicare and Medicaid Administrator Dr. Mehmet Oz revealed two proposed rules that could drastically limit access to essential medical services for transgender youth. The first rule would prohibit federal Medicaid reimbursement for gender-affirming care provided to individuals under the age of 18, while the second rule would eliminate all Medicaid and Medicare funding for hospitals that offer pediatric gender-affirming treatments. This sweeping action comes at a time when 27 states have already enacted bans on such care, raising concerns about the future of transgender health services nationwide. Advocates for transgender rights and healthcare professionals have expressed alarm over the potential consequences of these regulations. They argue that the new rules could make it nearly impossible for transgender minors to access medically necessary care, regardless of the state in which they reside. The American Civil Liberties Union has announced plans to challenge these regulations in court, indicating that they will not go unopposed. The announcement follows a series of controversial healthcare bills passed by Republicans in the House of Representatives, including one that would criminalize the provision of gender-affirming care to minors. This legislative package has sparked outrage among advocates who argue that such measures infringe upon the rights of families to make informed healthcare decisions in consultation with their medical providers. For one mother of a transgender teenager in California, these developments have created an atmosphere of fear and uncertainty. She shared her concerns about the potential impact on her family if they were to speak out publicly. "It feels like we're being hunted," she said, reflecting on the challenges they faced in seeking gender-affirming care for her son. The 15-year-old has been undergoing hormone therapy for 6 months, a decision made after extensive discussions and research by the family. He described the experience as a crucial step towards aligning his physical body with his identity, likening it to following a path that leads him to where he wants to be. However, he expressed anxiety over the new regulations, fearing that they would derail his journey and leave him feeling lost. The new rules have sparked significant backlash from medical organizations and LGBTQ advocacy groups. The Human Rights Campaign, the largest LGBTQ civil rights organization in the U.S., condemned the regulations, stating that they would obstruct access to best practice healthcare for transgender youth. The Trevor Project, an organization focused on suicide prevention among LGBTQ youth, warned that restricting access to medically necessary care could have dire consequences for the mental health and well-being of transgender and non-binary young people. As the proposed rules move forward, they will be published in the Federal Register, initiating a 60-day comment period before any final decisions are made. The implications of these regulations extend beyond the United States, as other countries observe the unfolding debate on the medical and ethical considerations surrounding gender-affirming care for minors. With the likelihood of legal challenges and public outcry, the future of gender-affirming care remains uncertain, leaving many families and advocates anxiously awaiting the next steps in this ongoing battle for rights and recognition. That's all for this story. We upload videos every day covering many different subjects, so hit that subscribe button to stay informed. Thanks for watching.